everyone, it's me Faith Mas from C1A, and today I will present my project proposal in discrete structures. So I will discuss my project proposal in discrete structure, and this is all about CallDOc 24/7 digital clinic for implementing technology for healthcare. So this is related to the current situation here at the Philippines, not just only in the Philippines, but all over the world. And why? Because in the year of 2020, COVID-19 was spread over the world. So this kind of big unexpected struggle that we experienced since 2020 until now 2021. The current situation of the hospital when the coronavirus was spread here in the Philippines, they urgently setting up field hospitals as quarantine facilities, while with the affected patients of COVID-19 are still increasing. And then after the news, they urgently announced that everyone needs to stay at home for a while, but in reality, it's been 1 year and it will be 2 years in year of 2021. Then eventually, even the doctors sacrificed their lives to save more people. And the bad news is during that time, the number of doctors here in the Philippines were decreasing. At the same time, the count of numbers of patients here and also the other people that passed away. So today, in the current situation, we need a new platform to be guided to everyone. Increasing both access to and quality of healthcare is a global priority. There is one solution is to integrate technologies such as smartphone apps directly into care. Nowadays, we need a new platform or strategy on how we could assess them when they have a chance to consult their care illness, because we know that we have also a weak immune system, mostly this current situation because of the coronavirus. And digital care and digital clinics can supplement health and personal care by bringing a new platform to a virtual visit. Like in a class, we have a virtual class between the teacher and between the student. And that is a new platform for educational. Then it was suspicion to go inside of the hospital by having a chance to get infected. So hospitals, including doctors, need a new strategy on how they could assess the health condition of our fellow Filipinos. By how? During the lockdown, everyone must stay at home, and most of the affected are the senior citizen that needs a regular checkup, and for those people has a problem on their health condition. Example, like me, I have a heart disease, so I need a regular checkup, but because of the current situation, I can go out because that was fear of everyone to go outside or to go to the public places. So we had to keep that illness by ourselves. So I just wanted to introduce my project proposal. This is inspired by the UNTV public service. For me, I just wanted to improve or to have an advancement about this kind of AI or developing a new strategy or platform for everyone in the future that can be used if in case of emergency like this, the COVID-19. We're not prepared to have a new platform for our health system. So during the pandemic, I inspired and I motivated to research this kind of project proposal and to develop it in the future. in case of emergency, and I call this the CallDOc, a 24/7 digital clinic and implementing technology for people's healthcare. A kind of clinic that will continue to offer synchronous healthcare visits through video call or either call in case or by using a phone as an instrument, and extends these health visits via digital health tools such as smartphone apps or software. So, through virtual, it allows for precise monitoring of individual patients' symptoms and behaviors. Basically, this project proposal is for the improvement and advancement that could use of every hospital for their community service to be continuing the good deeds of the Filipino, to assess the other fellow Filipinos and to have a consultation about their health condition, because we are taking care each other, so we need to improvise and advancement technology that could help everyone in case of emergency in the future and also nowadays. In addition, the widespread use of mobile phones means most of the patients have a mobile device. Thus, repurposing this device to enable patients to take a more active role in their healthcare. So, it recognized that digital healthcare could improve the efficiency and cost-effectiveness of care, allowing for a new platform to delivery of services. So, this is my draft about that application of CallDOc 24/7 Digital Clinic. This is just a draft for a while. Problem statements and objectives. The statement of this project is to develop a new application as a community service during the pandemic, to identify the effectiveness by using a new technological development that could assess the health condition of the people in the community through virtual and easily accessed. The objective of this project is to understand the challenges and purposes to propose technology-based solutions that can improve the platform by having a new method of consulting the health condition in synchronous, as a new strategy to prevent the increasing number of affected by COVID-19 and for the sake of their health condition where everyone needs to stay at home, considering those people who are suffering through different kind of illness that could help some of the doctors through virtual, giving them a piece of advice about medicine and some activity that could help them to prevent sickness. The significance of the study will be a great contribution during the COVID-19 pandemic, also in the future. The result of this project could be the highly significant and beneficial, especially to the following. This study will be a great contribution to the people in the community, considering the senior citizen, adult, children, hospital, and doctors. In discrete structures in the solution, basically we're going to use databases to keep track of patients and doctors while connects the traits of a certain piece of information, also including the three sets, because sets will allow the information to be grouped and put in order, including the sets of patients and sets of licensed doctors, including the set of facilitator. Since each piece of information, each trait belonging to the piece of information is discrete, the organization of such information in a database requires discrete mathematics method. And also, we're going to add the cryptography to secure the password or the information that the user will be given. Through propositional logic, it helps a lot to consider the conditions of statements that must keep for the progression of the activity of that application. If the patients are able to use mobile application and if they have issue on their health conditions, then everyone is applicable to have a virtual consultations with their doctors. And if the application is effectiveness between patient and doctors, then the hospital will have a few patients during the complicated situation. Example of the pandemic this year. Thank you for listening.